innovative content, global audience.
Now, diabetes is something that has affected each and every one of us in one way or the other. It could be your mother, it could be your father, or one of your siblings, or maybe your partner. It is no longer a thing that is associated with the old, but even the young people as well. And now, what is it that we are not doing right about diabetes? And up till now, still, we do not have the cure, even though we are getting closer to the cure on daily basis. But now, the numbers of people with diabetes that we are seeing, the data is becoming so scary. Is it what we eat? Is it the lifestyle? Or what is it that we are not doing right? We have quite a lot to talk about today on the show. Diabetes, of course, because this is something, if you ask me, that we should talk about because it has to do with you, with me, or somebody that is very close to us, our loved ones, of course. And so I will want each and every one of us to sit back, relax, because this is our health, of course. Well, we talk about your health, my health, and our health, like the saying that health is wealth. And now, 14th of November every year is a day set aside, International Diabetes Day, to discuss way forward, for people living with this pandemic to, survive and, to make sure that they are being carried along in our society. The numbers of people with diabetes, for instance, in Nigeria is quite high. And so today, of course, I am not a medical professional. I have with me today on the show, I have a professional today on the show that will be discussing some of these topical issues with us today. What to do, how to detect the symptoms, and of course the treatment and the lifestyle. And don't forget that 2023 Diabetes Day, the team has access to diabetes medicine and cure using WHO packages as enablers. Now, this was the theme for this year's some days ago. It was actually celebrated Monday, I guess. And of course, that is why today on my show this week, I thought it wise to bring this topic here today, this very sensitive topic that each and every one of us has been suffering from. When we look at our young people today, and just maybe one would say is the lifestyle or something we're not doing right. And what is the relationship of someone with diabetes, with sugar, with BP? These are some of the issues we'll be looking at today. And of course, what to eat, what not to eat. We have a lot of myths and facts as far as diabetes is concerned. Like I said, welcome. This is our health, and we're reaching you live from our SRTV studio here in London, the world's capital city. I'm Princess Kessy, and you know that your health will always come first. I have with me this morning, viewers, a very vibrant Nigerian doctor, Dr. Kessy Onozulike. He's the MD CEO of Eagles Nation Healthcare Center in Abuja, as our guest this morning to discuss some of these very topical issues. Good morning, sir.
Good morning to you, Princess.
How are
nice
you
having you. I'm okay.
Same here, sir. And as a very quick one, we know that we just had the International Diabetes Day some days ago, and of course, the team has as access to medicine and of course cure through WHO packages. Now, but to a layman, we know that I don't want to believe that there's anybody who doesn't know what diabetes is, and of course, or who does not understand it. But to a layman watching, what is even a diabetes? Now, coming from you as a doctor.
Well, when you want to talk about diabetics, it cannot be overemphasized. It's something that we all are aware of what diabetics is all about. But in a layman term, or for us to know more about diabetics, we should be talking about a chronic condition that occurs when the pancreas could no longer make insulin or produce insulin. Or you can also say that diabetes is when the body can no longer utilize insulin effectively. When the body can no longer utilize insulin, other words known as high blood sugar level, which is the glucose, the rise in glucose. And when you talk about all this, you need to also know that insulin is a hormone made up by the pancreas, that act like a key to let glucose from the food we eat pass through the bloodstream into the cells in the body to produce energy. So insulin has to be the center part of the diabetes or what it is all about, having a particular organ in the body system called the pancreas. The moment the pancreas is no longer functioning the way it ought to function, then you will know one will definitely come down with high sugar level, which is otherwise called at a starting point called the hyperglycemic state. You know, when you talk about the hyperglycemic state, a condition where sugar is high in the body system or within the bloodstream. And so this is just a few interpretation of what diabetes is all about, because you first of all get to a hyperglycemic state before you talk of one being diagnosed of insulin. And if you don't know what it is all about, you won't even know when you have insulin in the first place. So you need to know what is insulin, understanding that is something that comes with our body system not being able to function the way it ought to function. Most especially when they talk about glucose, utilizing glucose by our body system. And so when the pancreas that is meant to produce insulin as well is not functioning very well, one will definitely come down with diabetes. As I believe as we go further, we will be able to hear more and ways for which insulin gets into the body system and the best way it can be managed or diagnosed.
Wow. Can you hear me, doctor?
Yeah, I can hear you.
Now, how can you talk so much? For us, some of us, the lay people, still struggling to understand. But how can this diabetes be detected? For instance, a patient is living with it without knowing. How would the person know that I have diabetes?
Well, there are many ways insulin can be dictated, starting from the signs and symptoms that it presents. Insulin have many types, but I want to explain the symptoms, and that will take me into explaining the types of diabetics. One of the
Okay.
ways for one to know that he's either predisposed to diabetes or is already having diabetes is the moment the body, the body have its own channels or frequency for which it functions. And once any of these frequency are no longer measuring in their ranges, then there's deficiency that have occurred in the body system. Then one will begin to feel more thirsty than usual, begin to feel thirsty. You see yourself urinating more often than you used to urinate more often. And also you see yourself feeling so tired and weak, most especially after food. Feeling
Okay.
so tired and weak, most especially after food, because food was actually supposed to produce energy. And imagine you after food, instead of generating the necessary energy needed, you are now feeling weak. And so when you feel weak after food, you begin to feel some irritable bowel movements, and you could also have what we call mood swing or mood changes. Once you begin to notice any of these symptoms, blurry vision, when you wake up in the night to go and ease yourself, you discover you feel slightly dizzy. And
Okay,
the
doctor, I think we have a little, network issues from your end because we.
okay. Let me check. Is it better now? Can you hear me, Princess? Hello, network. Can you hear me now? Princess, can you hear me now? Hello.
Hello, sir. Can you hear us now?
Can you hear me now?
Yes, it's better now. Your network was quite down, but we can hear you now. So go ahead.
Okay, like what I was saying is that the moment you begin to feel tired and weak after food, and having these constant mood changes or mood swing, as people rightly call it, blurry vision mostly at night when trying to go and urinate, and above all, getting lots of infections such as skin infection, vaginal infection, or gum infection. Cases where your gum begin to swell up, you begin to have, a kind of perioditis in your mouth and all of that could be the early sign or symptom of diabetes. And you are being advised that the moment you notice any of these symptoms, you need to seek medical attention. Going to the hospital, consulting your healthcare provider, and getting a screening done regarding diabetes. Though the doctor will have a lot of tests requested for you because these symptoms can be contraindicating to other issues. But one of the tests that will be required is fasting blood sugar or random blood sugar. And if the doctor want to go further, he could request for what we call the HB1C test, all of these, or even insulin quantitative analysis. All of these tests can give us a diagnosis that one is diabetic or not diabetic.
Now, what are the challenges of living with this pandemic, as is usually called, sir? Okay, I think a little bit of network issues coming from our doctors and there, but from all what he has said so far, we know that we can talk about diabetes without, actually talking about the types and, of course, how your body reacts to it. The symptom, how you know you have the disease is when, of course, you after eating you feel weak and blurring when you're going to urinate, frequent urinating, and of course, after eating you are supposed to have energy, but when after eating you are now feeling very weak, and of course urinate frequently. These are some of the symptoms uh, for you to know that you have diabetes. And it's quite worrisome too, because diabetes is something now that we're seeing that it has to do with every one of us, not just one person. Like I said, you can say I don't have diabetes, it's not my portion, like we Nigerians we used to say, or what's my business with diabetes. Like I said, a lot of people, it could be your mom, it could be your dad, it could be your partner, it could be anybody. But if you notice and if you look at it critically, you come to understand that for each and every one of us in every home, or at every given time or point, you see that there is somebody in our family around us, a friends that is actually faced with this pandemic. And this is a attempt like the World International Diabetes Day that happened just barely some days ago. Now, I think it's aimed at, getting access. And don't forget, I was going to ask the doctor, access to, medicine, access to quality medicine, not just medicine. And of course, we've seen the hike in price of the medicine. And so let's assume that, a patient does not have to that amount. I was going to ask him as well, what are some of the lifestyle we can, live with, we can adopt to make sure that, we cut down, since the medicine is now so on the rise, the expenses and all that. And then, and of course, maybe things we eat as well. When we talk about diabetes, I think lifestyle is a major factor to read. What are we eating? We practically eat sugar on daily basis. We practically swallow sugar. We drink sugar. We eat sugar, and we say, okay, we're having fun. I don't have issues with you having eating sugar. But sometimes you just find a way to drain out the sugars in your system. You can actually do that via different ways. Like I said, I'm not a professional, but since we have a professional here, I guess network issues, we're going to have him back on the show. But when we talk about diabetes, the things you eat matters a lot. You can be eating them now. You're healthy, you're strong, you're sound. But how sound will you be in the next 5 years or in the next 10 years when we eat these things and then you do not live according to the way you're supposed to live? Anyway, we'll have our guest back, so I'll just allow him to continue because, like I said, I'm not a professional. Welcome back, Doctor.
Thank you so much. My network reception here have been very bad.
Okay.
But like I was saying, once you get to know any of those symptoms I have mentioned, one is being adjourned to consult his or her healthcare provider, who is in the best position to carry out some laboratory investigation, like the fasting blood sugar, the random blood sugar test, and he can even go further to recommend other tests, because some of these symptoms are contraindicating to some other cases that may be an underlying illness that you're not even aware. So any moment you feel any of the symptoms that have been itemized above, you are required to go into the hospital and have yourself checked. But looking at this, we need to understand that symptoms for diabetes comes depending on each type.
Okay.
It depends on each type, because we have three major types of diabetes. We have three major types. The number one is the type 1. The type 1 is the insulin dependent diabetes. The insulin dependent. This insulin dependent type of diabetes is the one that can happen within childhood. It could happen to children of all age, starting from 2 years. A child can have it starting from 2 years. Because what this means is that the pancreas is not producing any insulin at all. So you will be needing the external insulin to survive. You will need insulin to survive. And this type of diabetes may not come with the symptoms we mentioned earlier, because a child of 2 years old would not even know that I am feeling dizzy, may not even know that I am my mood is changing. But as parents, yes, but as parents, you will notice that some things are going on. The child will become very skinny. The child will become very skinny. The child will begin to suffer what we call muscle waste. No matter the kind of food the child eats, the child will not, the weight will, as if the child is suffering from stunted growth. And so when you observe any of these as a parent, you are expected to check if your child is having the type 1 kind of diabetes. And having said this also, you need to also understand that there's also a type 2 type, the one that is called the non-insulin dependent. This is non-insulin now. And this can come as a result of lifestyle. It could be hereditary. It could be something that is passed due to family history from mother to child, from, your parents had it, you are meant to have it, depending on family history. If you didn't do anything to prevent them from happening to you, it could be as a result of, you need to understand that also some persons eat very late at night, maybe due to their work schedules. So you can imagine eating late at night, the food is not going to digest properly.
At all.
And if it digests properly, it simply means you are putting more weight or load on the pancreas. When the pancreas is not supposed to be doing the job it's meant for, you are forcing the pancreas to get the job done. So these kind of persons are exposed to the type 2 kind of diabetes, which is very common among adults. It's very common among adults, adults of all age. Before now, it used to be from 40 years and above. before now. It used to be 40 years and above. But these days, if you look at the research, if you look at the latest research, or you go back to check the International Foundation for Diabetes 2021 report. When you look at International Foundation for Diabetes 2021 report, you will even notice that children below 18 are now having type 2 kind of diabetes. And reasons for this is, one, people are no longer cultivating the habit of having a daily exercise as routine.
Okay.
People now eat all forms of junks, all forms of food. We no longer filter what we eat. We eat whatever comes our way. We eat at all times. Most people don't even know that fasting is part of health management. Yes, it's part of health management. And so when children begin to indulge abusive kind of lifestyle, alcoholism, smoking, into drugs, injecting all manners of things, these are what the research is showing as reasons for children below 18, 20 and above are now coming down with type 2 kind of diabetes. And when you talk about the last one, which is the gestational type of diabetes, this one is common among pregnant women. It's common among pregnant women. Because the moment one is pregnant, the moment one is pregnant, the hormone changes. There are hormone changes. And if one have already been predisposed to this, the blood glucose level at that time goes higher than it should be. This woman, if not well managed, could come down with diabetes. But this kind of diabetes sometimes also goes away after childbirth. It sometimes goes away after childbirth, but insulin can be used to control this during pregnancy till the 40 weeks of gestation when the baby will be born. And so these are the types of diabetics, as we will all know. And when you know all of this, you now know when the symptoms are presenting are right for you to seek medical help.
Well, sir, now you've talked quite a lot, and from all what you've said so far, if not very well handled, at the end of it could lead to something very serious. Now, what are some of the things you talk about? Is it other health conditions, of course, and what are some of the dangers of living with it and not being properly managed?
Well, when you look at the high rate of heart problems today, cardiovascular diseases, when you look at the heart rate of cardiovascular disease, looking at a young man of 30 years coming down with stroke, a young man of 30 years coming down with stroke. When you check properly, if it's not hypertensive, he's diabetic.
Okay.
So these are some of the contraindications that comes as with improper management of or poor management of diabetes. They are predisposed to, or their most risk factor is cardiovascular diseases. Cardiovascular disease it could be heart attack, it could be heart failure, it could even be renal failure. It could be what we call nerve damage. Medically, it is called neuropathy. It could be neuropathy. It could be also nephropathy. It could be also retinopathy. All of these things are due to complications that comes with poor management of diabetes. But the most common, which is also the most common killer disease among those who are diabetic, is heart problems.
Okay.
Heart problem, cardiovascular issues, could be like stroke, as I said, or heart failure. So these are the common complications that come, or it could even lead to wounds, untreated, complicated wounds, complicated diabetic foot wounds that might lead to amputation of that part of the body if it's not well treated. I have seen a case where a woman is diabetic, and she's been diabetic for more than 2 years, and she's not aware that she's diabetic, and she had a sore. This sore is directly behind her hip bone, and she's been managing it as blisters, blisters. She'll be managing it. She goes to the pharmacy, she goes to the chemist, she goes to people all around, she goes to herbal homes and so many places. And nobody was, I don't know what happened, that nobody checked her to find out if this is diabetic. And before we discovered that she's diabetic, it was already late, and one of her legs had to be amputated. And today, she's not herself, she's not happy with the situation. And so what we're advising is that early detection is the key to recovery, if not cure or proper management. So the moment you notice any symptoms that is diabetic related, please, I advise you this morning to seek medical help. Consult your doctors. Doctors are always there to provide advice. You can even walk into a hospital and say, I want to have a routine check. I want to have my body system checked. And the doctors are there to attend to you. So these are the best ways we can avoid these contraindications or complications that come with diabetes.
And now you did talk about, early detecting of the diabetes and of course the stages as well. But
Yeah.
This woman, I want to believe that there were stages, but she didn't, like you said, she didn't get to find that on time. And that actually led to another thing she's not very happy with. But now, having detected this, diabetes, what are some of the ways to manage or to live with it? And of course, the symptoms, can you even, the stages rather, can you break it down a little? Is it the same thing with the symptoms? When you start feeling the symptoms, that means you're already at the stage of having it, or it's going from stage to stage, or apart from this, away from the symptom, it comes in another way, like stages, or is it the same thing as symptoms? And then how do you manage and live with it? Because I'm aware that there is no cure to it.
Well, diabetic is not a death sentence. Being diabetic is not a death sentence. And the moment one discovers that he or she is diabetic, it's a matter of lifestyle. Just like you will know that none of us is being reminded to drink water. Am I right? We are not being reminded to drink water. The moment we feel thirsty, what do? We drink water. So one of the ways to, because diabetic stages, like I said, is linked to the type. It's linked to the type of diabetics that one is having. And so you must understand that these challenges, presently there is no cure for diabetics, but it can be managed. It can be managed to the point where one will live as long as his maker will want him to live on earth. There are medicines, there are food plans, diets, exercises, avoiding alcohol, managing stress. I think I need to pause a bit and emphasize on this. Stress, if it's not well managed, is a very silent killer. And it complicates diabetics to the point where one could come down with stroke, not knowing. So we must learn how to balance stress, because like I tell you, Princess, you need to understand that 50 to 80% of deaths in people with diabetics is as a result of the increased stroke level that comes with it. 50 to 80%. I don't know if you can still hear me. And so when you understand this, one must know that there is what they call insulin of different kinds. Your doctor will prescribe that if you are diabetic. Your doctor will also decide the best of medications to be given to you to manage diabetes at all stages, be it type 1, type 2, or gestational type of diabetes. There is always management for it, and it can be well managed to a point where you can use your diet to manage it properly. Network is off.
Doctor, can you hear us? I think network. Can you hear us, sir?
Okay. Yeah, can you hear me now?
Yes, I
can. You hear me now?
Yes, the network is quite down, but we can hear you now. Go ahead.
Okay, what I was saying is this, that the stages of diabetics is as the same as each type, the type of diabetics that one is having. Okay. That type of diabetics, yes. So if it's type 1, the person must be on insulin.
Okay.
He must be on insulin. And insulin in combination of diet will help you to manage diabetic effectively.
Okay.
And if it's type 2, there are other medications that are not just only insulin. Insulin comes in if other medications are not being able to manage it properly. Take, for instance, the glucophage, the Dionin, Gavosmed, and so many of them that are prescribed drugs. Because most of these drugs are prescribed drugs, like the metformin. It must be prescribed. You shouldn't just walk into a pharmacy and said, okay, I heard it on one TV show where the doctor said you can be on this and be on this. No, I'm just telling you the kind of medications that can be prescribed by your healthcare providers after series of investigations have been carried out. Because let's take, for instance, it's slightly above the normal range. Slightly above. Your doctor may not choose to start you on medication immediately. He might ask you to go for exercise, have your meal change, stay away from refined sugar, and so many other things. Because sometimes people, is deceiving that people would think that it's carbohydrates that is the cause of diabetes. No.
So what is the cause then? What is the major diabetes?
No, it's amazing because most of the food, most food that we consume in this part of the world is carbs. So what you need to do is just moderation with it. You moderate the portions. Portion control comes in. When you take in portion control, exercise properly, stay very active, and be positive. Be positive. Be a positive person. I can tell you the truth. Even when it's slightly above, it can come back to normal. It can come back to normal. It can come back to normal.
Wow. And now, what can people do, for instance, somebody that does not have diabetes? What can they do to prevent it in the future? You did talk about heredity, pregnancy. Of course, that one cannot be controlled, I guess. But you talked about other ones. So even children, what can we do to, live above or avoid it? If we can actually live above it.
Well, like I said, one of the best ways to prevent disease, not just diabetes, one of the best ways is to maintain a healthy lifestyle.
Okay.
A healthy lifestyle. You must maintain a healthy lifestyle. You must learn to balance work-related stress. You must learn to balance work-related stress. You must learn to sleep well, sleep properly. You must give the body the rest it requires to function harmoniously. you must also stay hydrated. You must stay hydrated, because when there's no, we don't drink enough water, and looking at it that the body requires at least 1.5 to 2 liters of water per day at most, one must stay hydrated. And if there is a family history of diabetes in your lineage that is linked to your lineage, all you need to do as a young girl, as a young man, as a young woman, is to begin to maintain a healthy eating habit. Healthy eating habit. Don't just put anything you see out there in your mouth. Scrutinize whatever you eat and eat the right portion. So I will advise that every family, every individual requires at one point or the other to consult dietitians or nutritionists. And above all, maintain a healthy weight. A healthy weight is very important. The moment you notice your weight is going, high, you are expected to look for a way to cut them down. That is the moment we can say, okay, cut down your carbohydrate level, eat more vegetables, fruits, stay with foods that are more rich in ions and so many other things. And I can tell you the truth, you can prevent diabetes, even if it's in your family lineage. You can prevent it. And also live a positive life that will not slip you into depression or anxiety, because all of these things have a negative effect on the body system. And when this negative effects comes on the body system, you don't even know, not just diabetes, other diseases could crop in due to when the body failed to maintain a homeostatic state. Then you could see problems can come in at all times. So my advice this morning is that you can prevent diabetes. You can prevent it being physically active. That is one of the ways you can do this. You must be physically active. Not to go to the gym to carry weight. No. That is not what I mean by being physically.
Because that is the misconception here, doctor.
No. Not to go to the gym to carry weight. That's not what I mean by being physically active. Physically active is you are a positive thinker. You are someone who gets things done without being reminded. You know how to manage your stress and rest. Take a walk. Places where you need to walk to, you don't need to drive down there. Take, for instance, you want to go to a supermarket that is not 500 meters away from your home. Why do you need a car? Why do you need a car? You can walk down there. These are ways to be active and stay hydrated at all times. Because every person that ends up in the hospital ends up with one infusion or the other. If it is non-normal saline, it is dextrosaline. If it's not dextrosaline, it's one other infusion. The reason is that the doctors have seen that you are dehydrated. And dehydration also will give back to so many things. And so that's why I'm advising this morning that we must maintain a physical activeness. We must be very active persons. We must manage our stress. We must eat healthy and maintain a healthy weight. And these are the ways one can prevent diabetes. And even if you have it and you follow these steps, it will also help in management of diabetes and for a healthy living.
Anyway, I was going to ask you that people already living with it, how can they manage? But since you said that they can actually take all these steps and then it would be a better way of managing it, that is good as well. And now, but let's talk about, you did talk about, weight management. How do you know that you're overweight? Do you have as an adult? Because we have different body weight and sizes. I might be a slim person, I might not weigh up to that. And another person naturally, it's just your body, they are plumpy or maybe they are fat, and then that is just your body. Now, how do we balance it, sir?
The best way to maintain your weight is to have a routine weight check.
Okay.
Routine weight check. At least once or twice in a month. Put yourself on a scale. when you put yourself on a scale under the supervision of a healthcare provider, the healthcare provider is going to do what we call, is going to do the conversion, checking your BMI, your body mass index, times your height and weight, telling you whether you are obese or not. Because the moment your BMI begin to go high, you need to do things that could bring it down. You need to do things that could bring it down. So having a routine weight check is very, very important for every human being that is living. It's very important, and it takes you nothing. Some hospitals does this free. In fact, some pharmacies, you enter there, you see a weighing scale. Take advantage of that. Put yourself on the scale, and thereafter, if the ranges is confusing, you can ask question. You can ask question. You can consult your physician, or you talk to your nurses or whoever that is in charge, and they will be able to explain to you whether you are maintaining a normal weight or not.
And now we've seen that, over the time, when you see people living with, having diabetes, we now see that it's something that's, it's gotten to a point. I'm not a medical professional, but you see people, doing something, checking at home, the process of managing, I guess. They cut their hand or they put something and they check through all this process in a way of managing it. But apart from that, and apart from the things we eat and the lifestyle you did talked about, and at what stage and point of it while you are home you've been able to manage and be cutting your, because I saw somebody cutting and putting one paper like that and say she's trying to check. Now, at what point, even while you're living with it, you feel like you're healthy, you're on the medication, or maybe on a daily medication, but at what point do you need, how often do you need to still go and see your service provider or maybe your doctor?
Okay, thank you so much on that. The moment one goes to hospital and it is discovered that he or she is diabetic, the doctors will advise you to get a machine called the glucometer. Okay. The glucometer, which is a machine that is used at home to check, most especially your fasting and your random blood sugar. Okay. And also, if you are somebody who is placed on an insulin, the doctor needs to know your performances with the insulin. And so that will give it to you and ask you to do a fasting blood sugar test. That is, check it in the morning and record it down. Have a chart at home where you record it. And the moment you check in the morning and you discover that your sugar level is maybe 4.5 or 4.0, take for instance, you will write down 4.0 millimole or medium, whatever it may be at that time. Then when you eat 2 hours after food, you are also supposed to check. That is a random. When you check that one, the next appointment that the doctor have given to you, you will take that booklet to the doctor. The doctor will now look at your performances at home with your meds or with your insulin injection. He will know whether to reduce the dosage of the medication or to increase the dosage of your medication. Even at some point, the doctor might even ask you and say, okay, for now, take this medicine once every other day and maintain this type of food and do this and do that and this and that. And that is the management we are talking about. Because when you don't have this machine, you will not be part of the management. And for one who is diabetic, it is expected you are the 70%, you own 90% ownership. You are in charge. You are expected to monitor yourself routinely. And the information you have at home is the information that the doctor will require to further take good care of you. And so that is what you see the women do at home, like the woman you talked about putting paper, cutting her hand. So it is a machine, it is called glucometer. It comes with a strip and also a lancet. The lancet is meant to pierce the thumb and bring out some very small blood and put it through the machine. It gives you the reading. And once that reading is done, you are meant to chart it down because your doctor will look at it at his own time, peruse through it, and he will tell you, congratulations, madam, you have been doing so well at home. Keep it up, keep it up. And the moment the doctor gives you a thumbs up, it goes a long way. It goes a long way in recovery, in management, in mental health, and whatever you may talk about.
Wow, thank you so much, Doctor. But now let's look at it from this way. You did talk about the things we eat, lifestyle, and somebody living with diabetes. That means, or you have to be intentional, like you said, about the things you eat. And of course, we live in a society that practically everything we eat, contains carbs and of course sugar and most of the drinks and everything. Now, there's this means and fact about diabetes. Don't drink this, don't eat that, don't do that. And you see people practically living on plantain, on ripe plantain alone. I've seen somebody eating, my mother, she would tell you, doctors, I should not eat any other thing. It's only plantain and vegetable. And I don't know how long, I think, I can't even remember when she started. I was quite little. And you could see that over the years, that has been her custom of eating this specific food, but then was still battling with it, this sugar and this high in sugar and all that. Now, what is it that they are not telling us, the lay people, about food? You did talk about carbs being in everything we eat, and then the major food for diabetes in Nigeria, for instance, is plantain. Now, how correct is this?
Well, like I said earlier, I have a friend, a colleague who is a diabetologist, as who manages diabetics. And one of the things I've seen him ask his diabetic patients to do most of the times is to eat all forms of food in a moderate portion.
Okay.
In a moderate portion. I have seen him ask his diabetic patients to eat gari, for instance.
Okay.
With vegetable soup. And so what we're saying is this. There are a lot of false information all over the place, all over the internet, and some other things you hear from the hospital. But the moment you see a professional will tell you that whatever you need to eat must be moderate. 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 And on ripe plantain, as they say, if you research it very well, if I'm not mistaken right now, you discover that a spoon of it has even about 500 grams of carbohydrate. So it's not as if that on ripe plantain is safe from carbs. No, it's not safe from carbs because everything we eat within our environment are GMOs. They are GMOs, spectrum modified foods all over the place. But the moment you can eat anything, your physical activity is what requires the metabolism that takes place. And once the proper metabolism and proper digestion takes place and the food is being converted from glucose to glycogen, sucrose and all of that, and is well distributed, remember, you are on medication. Your sugar level will definitely come down to a normal level, a normal range, or a bearable range. So it is not about specific diet. I stand to be corrected. It's not about specific diets, but diet is important. It's very, very important. But what you must take home is the portion for which you consume. The portion. Some persons have told you that my doctor said I should not eat gari. I was asked to eat oatmeal. I don't know whether you can hear me.
Yes, I can hear you.
I was asked to eat oatmeal by my doctor because it contains fiber and all of that. And you decide to eat 3 bowls of oatmeal as lunch. What do you think will happen to you? No. You understand?
Yes.
You understand? So moderation is very important. Moderation with stress, moderation in all that you do is important. This is the key, the main key to combating diabetes. Moderation. Because what is good for Mr. B may not be good for Mr. C. And what is good for Mr. C may not be good for Mr. B because we have different body systems, different body mechanisms.
That is
Even
true.
two identical twins does not function the same.
The
They
same.
don't function alike. They don't function alike. So, but when you have moderation in what you do, quote me anywhere, you will definitely have a good management of diabetes.
Well said, doctor. But just before we let you go, so it's safe to say that diabetes does not have a permanent cure. So while you have it, you will have to keep managing and maintaining what you eat. Is that what you're saying?
For now, there is no cure for diabetes. Even though when you look at, I saw an alternative medicine article which proved to have come up with a cure. But we have to scrutinize it.
That is true.
We have to scrutinize it. But globally, there is no cure for diabetes. And for you to know, for better purposes, you need to understand that globally, from the International Foundation for Diabetes, as at 2021, 537 million people globally are diabetic. 537 million people are diabetic. So bring that home. And from this, you also need to understand that over 6.7 million deaths was recorded. So we are not here to just talk. We are here to make people understand that your health is your wealth. You can't go far in life if you are not healthy.
That is
So
true.
whatever it takes to be healthy, we
Do
must
it.
do this. We must do this. We know that environmental factors, cultural practices or heritages could be factors that affect our health, but we can find our path even in the midst of the storm. There's always a way to go. And like every other doctor will say, I want to say this. I want to say this to everyone who is listening. Your health begins with you. Your health begins with you.
I
So
love
from
that.
today, have a habit of routine check and a habit of staying active, habit of being hydrated at all time, and having a good rest. You can prevent a lot of diseases by doing this. Thank you so much.
Thank you so much, Doctor. Thank God for this show today because I was wondering, the rate at which even the young people are not caught with this diabetes thing. But you did talk about lifestyle and a lot of things. So I think there's a lot of take home for me today. There are things we need to do as a people, as a community, as a family, as
Mm.
challenges this morning. But thank you so much, Dr. Kisley Ono Zulike, MDC of Eagles Nation Healthcare Center in Abuja. Thank you so much for being on the show, and thank you for the class. I call this a class. I've learned so much today, even as a person, as a presenter. I have a lot of take home today, and the make believe and the myth and the fact that you don't eat this, you don't eat that, you don't do this, and then at the end of the day, you find out that you're still where you are. So I think awareness is the thing we should do about diabetes. People need to be, especially our mothers, our fathers that are not very abreast with issues are things technology. We need to make them understand that you can eat in moderation everything, and of course vegetable water and all that is good as well. Thank you so much. Hopefully we'll bring you on the show
Thank,
again to
thank you
continue
for
this discussion. Thank you so much for obliging us your time this morning. We appreciate your time.
thank you so much for having me. I'm very grateful.
I do have
It's
a
my
very
pleasure. It's my
thank you.
pleasure. Thank you so much.
Yes, viewers, I used to say it, and doctor said it, your health begins with you. And that has been my saying here, your health is your wealth. You cannot go far in life if you have health issues. And that is why on my show, I used to say it, your health will always come first to us, to me, here, the presenter. And so I don't know what you are. We know that factors like economics, cultural, whatever is there. But please make sure, as you know, as a person, as individuals, make sure that you live well, your lifestyle. Drink water. Water is good for your health. Eat vegetable, eat in moderation, do exercises, walk around, have a positive mindset. And just maybe you live above that diabetes. And of course, you can, avoid having diabetes. So see you again on the show here next week with, of course, another interesting topic. But while you are out there, remember that your health will always come first. So whatever you do, think about your health first. I'll see you again on the show next time. Follow us on our social media handles. Follow us on Instagram, Facebook, Twitter, and S. And of course, follow us on YouTube. Subscribe, invite somebody to the page, leave us with your opinion, and of course, hit on the notification bell. We'll see you again on the show here next time. Your health matters to us. Bye.
Are you a filmmaker in Abuja and its environ? Do you need a place for your music video, or you need a venue for your conference and even an editing suite for your post-production? Look no further. Our beautiful Torrate in Lokugoma has it all. We have a whole floor that consists of 3-angle lounge, a beautiful dining area, a large kitchen, a conference area that can comfortably accommodate 60 persons, and 5-bedroom adaptable for all kinds of shoots. The good news is all is available at affordable price. And you know what? If you are a member of the Association of Movie Producers of Nigeria, you have 20% discount. So what are you waiting for? Hurry and contact us on the numbers on your screen now.